are doctors sometimes going the wrong path in treating the coronavirus, and will we find that out? I've invited Kevin Pham on, who's with the Heritage Foundation. Kevin, it's a pleasure to have you on the program. Thanks so much for taking the time.
Very pleased to be here. Thanks for having me.
Now, you wrote a profile, and I don't know, his last name is Yadigar. Is it Dr. Thomas Yadigar?
Right. Yes.
So this guy is a guy in Tarzana, California, critical care physician for 20 years. So he specializes, if you're really in trouble, if you look up and see Dr. Yadigar above you and you're in intensive care, you know you're in trouble, but you know you're in the hands of a guy who's been doing this for a long, long time. And you talked about something he determined about the way that coronavirus is being treated. So we're not talking about some fly-by-night guy on late-night TV. We're talking about a guy at the Providence Cedars-Sinai Tarzana Medical Center. He knows his stuff, and he thinks he's discovered something really important about what we're doing right and what we're doing wrong in treating this coronavirus.
Right. What he's discovered, at least in his unit, we have to make sure that when we're talking about these things, every ICU is probably going to have a slightly different experience with the virus, partly because the virus mutates and changes a little bit by little bit in different areas, but also just because the total sample size in one ICU is going to be relatively small. So what he found in his unit is that it's not really the virus. It's not the direct effect of the virus that's killing people. What's actually killing people, that terminal stage of the disease, is actually an inflammatory response that's overactive in the person's body. That's doing all the damage to the person. So if you're trying to treat the virus as a person's dying in the ICU, if you're trying to treat the virus, you might not be treating the right thing. If you start trying to treat the inflammation, then this person has a much better chance of surviving. At least like I said in Dr. Yadigar's ICU.
And with an awful lot of medical problems that human beings have, you treat the symptoms, right? Somebody walks in and says, I'm bleeding. You stop the bleeding. Somebody says, I can't breathe. You help them breathe. And you've suggested, or this doctor says, Dr. Yadigar says, he believes that in trying to help people breathe, doctors may actually be making the problem worse instead of treating the thing that's making it hard for them to breathe. Do I understand that right?
Right. So a lot of the early guidance that came out of like China and Italy was saying that as soon as someone starts to decline, then put them on a ventilator as soon as possible to prevent further decline. And that there's a lot of reasoning behind that, because when a person starts declining with a respiratory virus or respiratory illness, then all of a sudden their organs aren't getting enough oxygen. And then
right.
That's when you start getting organ damage. But what we're finding out, or at least what Dr. Yadigar is finding out, is that when you're mechanically ventilating somebody, that's causing it's a highly invasive process, having a tube stuck down into your lungs and then having air forcefully blown into it. That causes an inflammatory response too. So if inflammation is causing the initial decline in respiratory function, then feeding back into the inflammatory response is actually going to make it worse, not better. So the people who are getting off of the ventilator, they're doing it in spite of the ventilator, not because of the ventilator.
And you've also said that there was some other guidance that these doctors get. And I understand, Kevin, I'm not a doctor. I don't think you're a doctor at Heritage, but we try to understand how this thing works, that some of the advice that they were giving doctors was, don't try them on these inhibitors that are designed to go after inflammation because they can make the problem worse. But that turned out not to be the right way to go. Can you describe that?
Yeah, sure. And actually, I am a doctor. I am an
Oh, I'm sorry, doctor. So, I apologize. I didn't realize.
Okay. No, it's fine. I just want to make sure that, I'm trying to explain this in a way that other people understand, so stop me if this doesn't make sense to you. But the IL-6 inhibitor, IL-6 is interleukin-6, is a modulator in the body that increases the inflammatory response. When it's doing the right thing, then it's very effective in stopping bacterial and viral illnesses. But this virus seems to be able to kick that into overdrive, and then it starts attacking itself. So it's not the IL-6 that was sort of introduced a little bit later. What people were saying not to do was giving an anti-inflammatory drugs. So at early disease, like when it's mild and moderate, don't give them NSAIDs like Advil and stuff like that. And when it starts getting worse, don't give them steroids unless they absolutely need it for a different condition. What we're finding out is that, steroids is exactly what you would need if you're trying to treat an inflammatory disease. So they're saying don't give steroids when that was actually one of the most important things that's saving patients in Dr. Yadigar's ICU. And then you combine the steroids, which suppresses the immune system more broadly. You combine that with an IL-6 inhibitor, which cuts off the inflammatory response. So you put those two, and then you basically flatten the inflammation in a person's body, which gives them a chance to recover from the inflammation, and then they'll be able to be healthy to fight off the viral infection as well.
So, Dr. Pham, now that I'm calling you by the correct title, Dr. Pham, you have to watch how you do this, because if you're giving them steroids that knock down your immunities, then that opens them up perhaps to other kinds of bacteria and other kinds of infections that could mess them up. So the doctors who do this have to do it very carefully.
Correct, and that's one thing that we always train, is that you treat the patient in front of you. You're not trying to treat lab results. You're not trying to treat some disease that's in a textbook. You're trying to treat a person. So if a person is in the ICU, especially if they're on a ventilator, then there's a high chance that they also have some other infection that's going on, especially if they've been in the hospital for a couple of weeks, which we're seeing a lot of people with COVID-19 in the hospital for up to 6 weeks at a time. If you're in the hospital that long, there's a good chance they're going to be infected with something else. And if there's something else that's bacterial and you give them a steroid, you just knock down you just put down the walls. All the bacteria can just run in and start causing a bigger mess than you started off with. So if you use these drugs, an IL-6 inhibitor, an IL-8 inhibitor, steroids and stuff like that, if you do that with someone with an active bacterial infection, you will kill them.
Ouch. Dr. Pham, last word. Are they going to be able to do some trials on this, or are there already trials underway saying, let's go at it this way, instead of putting them on a vent and all that you actually start treating the inflammation, get that knocked down so they don't need the vent, and then you can get them better? Is this under investigation now?
To my knowledge, there isn't a trial to treat it in this manner. But these are ICU doctors; they're highly trained. When they see this kind of thing happen, then they will treat it. And that's sort of how it's been treated as it is now, is that as organ systems start failing, they're treating that symptom. And so this thing is happening, but we should focus more on the inflammation and less on the virus, because if you're chasing the virus, you're chasing the wrong thing.